Today, we'll be talking about Clomid, also known as clomiphene. Clomid is a medication that is used to induce ovulation in women. Now, about 80% of women who take Clomid ovulate, which means this medication has a very good success rate. But there are critical things that you must consider when you are using Clomid. These things will increase your chances of getting pregnant with Clomid. And that is all that we'll be talking about in today's video. Welcome to my YouTube channel. Sit back and relax, and I hope you enjoy this video. Like always, if you've been trying to conceive, I'm very sure you must have heard of Clomid. Clomid is a very popular medication, but Clomid is not for everyone. So who should use Clomid? Women with irregular periods. If your period is irregular, it can be very hard for you to know when you are ovulating. This is where Clomid can come in. Women with PCOS, that is polycystic ovarian syndrome, or women who don't ovulate at all, Clomid can be very useful in this situation. Women with unexplained infertility. So you and your spouse have been to the hospital, done all the tests and everything, but then they still can't find out why you are not getting pregnant. Clomid can be a useful tool in your situation. And then women who are undergoing fertility treatments like IUI or IVF, Clomid can be used as part of the treatment. If you fall into any of these categories and you're ready to start your Clomid cycle, the first thing you should do is to get a baseline test. Don't skip this step. This is very important. You need a baseline test. And this test will usually include a blood test and an ultrasound. The blood test will measure the levels of your hormones and give your healthcare provider an idea of how well your ovaries are doing. The ultrasound will show if you have any ovarian cyst. Now, if you have a large ovarian cyst, you will not be started on Clomid because Clomid will make the cyst to grow even bigger. You have to wait for the cyst to go away or for the cyst to resolve on its own before you start taking Clomid. Now, don't confuse this cyst with a tiny cyst that can be seen in women with PCOS. That is different. Again, this baseline test will help your doctor to know what dose of Clomid you should be started on. Depending on the findings and how well you are doing, they may decide to start you on the 50 milligram per day or even a higher dose. It all depends on your baseline test. So you've done your baseline test and hopefully everything looks fine. You're ready to start Clomid. When should you start taking this medication? Usually, your doctor may want you to start on day 2 or day 3 or day 4 of your menstrual cycle. Now, day 1 is the day you start bleeding. That is the day you started your period. If your period starts after 9 p.m., don't count that day as day 1. Your day 1 should be the next day. So depending on what day your doctor wants you to start, for instance, if he wants you to start on day 2, you are supposed to take this medication for 5 days. So day 2, day 3, day 4, day 5, day 6 should be the last dose for you. If he wants you to start on day 3, you have to take this medication for 5 days, and that is day 3, day 4, day 5, day 6, day 7 should be your last dose. I don't know if you understand me. Again, for women with irregular periods or you don't get your periods at all, your doctor may decide to induce your period so that you can start taking Clomid. But first, get a pregnancy test done to rule out pregnancy before inducing your period and then starting Clomid. And it is also advised that you take this medication at the same time every day. So you can take it first thing in the morning or last thing before you go to bed. The moment you've had your last dose of Clomid, it is time to start tracking ovulation. Some women may choose to do this using ovulation test kits, but it is best to do this with follicular tracking. Now, follicular tracking is using ultrasound to monitor ovulation. Ultrasound will show you how well your follicles are doing, how many follicles are growing, and the sizes of the follicles. Ultrasound will also show you if you have more than one mature follicle. Having more than one mature follicle can potentially lead to a multiple pregnancy. I know you love twins. You want to have twins. But imagine if you have 4 or 5 mature follicles at the same time. That can lead to a high-risk pregnancy. And your doctor may decide to cancel that cycle and then lower your dose of Clomid so that you don't hyper-ovulate next time. Depending on how you choose to track your ovulation, if you're using the ovulation test kits, you have to start baby dancing the moment you get a positive. If you're using ultrasound, your doctor will be able to see the follicle, know when it is mature, and then when the egg is ready to be released. He will tell you when to start baby dancing. And with baby dancing, it is advised that you baby dance every other day. So if you do it today, you have to skip the next day and then do it the following day. You don't have to do it every day. You have to give your spouse or your husband time to replenish. Doing it every day will not really give you the best quality sperm cells. So you want to do it every other day until you confirm that ovulation has happened. How do you confirm ovulation? You can confirm ovulation by tracking your basal body temperature or using ultrasound or going for a progesterone blood test. Basal body temperature will show a sustained rise in your temperature readings. Ultrasound will show a ruptured follicle, and a blood test will show high levels of progesterone in your blood 7 days after ovulation. After you've confirmed ovulation, the 2 weeks wait begins. Now, this is the most difficult part of the whole process. It is a very stressful period for a lot of women because at this time you are anxious, you are eager to find out if you are pregnant or not. Sometimes you're even tempted to start testing 3 days or 4 days after ovulation, but you have to wait. Don't stress yourself out. Stay positive. Don't stay in bed all day thinking about the outcome of the whole process. Engage your mind. You've done your part. Allow God to do the rest. 1 week after ovulation, you can take a blood pregnancy test. 2 weeks after ovulation, you can take a urine test. And hopefully, you're going to get your big fat positive. If you test and it is negative, it could be that your HCG levels are still very low. So you have to repeat the test in 1 week or 2 weeks time. But if you repeat the test and it is still negative, or you get your period within the 2 weeks wait, or before the 2 weeks expires, then it is time to start a new Clomid cycle. I know it can be very frustrating. I know it is a very hard pill to swallow when you are not pregnant. It is okay to cry. It is okay to be sad. It is all right to be frustrated and disappointed. You are a human being. It is all right to have all those emotions. But please try not to dwell too long in those emotions. Get up, dust yourself, and try again. I want you to know that not all women will get pregnant with their first cycle of Clomid. Some women will get pregnant on their second cycle, while others will get pregnant on their third cycle. You can have up to 6 cycles of Clomid, but then most doctors will move on to other forms of treatment after your third cycle. And with your next Clomid cycle, your doctor may decide to tweak your dosage just to optimize your chances of conception. And hopefully this time you get a big fat positive. I'm rooting for you, sis. I'm rooting for you. Click on the subscribe button to join the family. Please like this video and share this video. Thank you so much for sticking with me to the very end. Bye and see you in my next video.